East Tennessee Children's Hospital does say it is now treating 6 children who are sick with E. coli. The hospital lists 1 child in good condition and another in fair condition, but 4 other children remain in serious condition. The Knox County Health Department says it recorded more than 10 E. coli cases involving children in the past week and a half. Investigators are still looking to pinpoint the source of the outbreak. WBIR 10 News reporter Stephanie Haynes joins us with a look at where that stands. Stephanie?
John, that's right. The source of the outbreak is still under investigation. The health department says possible links are raw milk consumption and exposure to farm animals. The health department took samples and sent them to a lab for testing, so it could be some time before we get those results.
When it comes to the E. coli investigation, the Knox County Health Department is looking at 2 situations. The first is possible raw milk consumption.
So when we made the announcement about the raw milk and named the farm, that was because there was a public action to be taken. Throw the milk away. We don't want more kids getting sick.
The health department says it believes the majority of the cases are linked to the raw milk consumption, but it is also looking into cases that are linked to Kids Place, Inc., a child care facility in Mascot.
Okay, what are the common things about these cases? And in this case, that daycare was common for some cases. So then at that daycare, what were the things that might have been an exposure? We didn't see any foods in there that might have put them at risk for E. coli, so we found the possibility of a link to animal exposure.
In a statement, Kids Place said a child came to their facility sick but was sent home. The health department says it recommended Kids Place close the baby house where they were finding the cases. The department says the kids were sent home and the risk was mitigated, but the State Department of Human Services ordered the entire facility to close on Tuesday.
Right now what we're doing is working with that daycare to get an action plan in place, to do environmental cleaning, to change some of their policies, and as soon as they've satisfied that environmental cleaning in that section, have a new infection control plan, we're satisfied they have policies in place, and we've done education with their staff, we will let them reopen. I'm not sure when that's going to occur.
The health department wants to remind people that when your child is sick, keep them at home. Don't send them to their care facility. Also, a lawyer is meeting with some of the families whose children are at the hospital. John?
Stephanie Haynes on the update. Thank you.